All right. Well, good morning, everyone. Thank you for all being here. This is an important day. We here to talk about our HR 1 bill with Medicaid and SNAP. And I'm going to start out by saying, back in July of 2025, the Congress passed HR 1, the One Big Beautiful Bill Act, requiring states to strengthen eligibility verification and conduct more frequent redeterminations for Medicaid and SNAP. States that fail to reduce their improper payments face increased penalties beginning October of this year. This is not optional. Federal law mandates reform. This is the law of the land. Arizona has about 7.5 million residents here, and nearly 1 in 3 Arizonans receive either Medicaid or SNAP. 1 in 3. Spending has surged alongside enrollment. Medicaid has grown from $13 billion in 2020 to $23 billion today. That's a $10 billion increase. SNAP has nearly doubled from $1 billion to $2 billion today. Combined, spending has increased from roughly $14 billion to $25 billion in just a few years, folks, in a trajectory that raises serious sustainability concerns. If Arizona fails to comply with federal law, SNAP noncompliance alone could cost up to $300 million annually in federal penalties. Combined, SNAP and Medicaid penalties could exceed over $360 million per year. Rural hospitals and providers risk losing millions in federal grants. Cost growth continues unchecked. This is not a hypothetical. This deadline is real. The penalties are real. Arizona House and Senate Republicans have advanced a comprehensive reform package that includes Medicaid eligibility modernization and verification, SNAP verification reform, Rural Health Transformation Program protections. This package complies with federal law. It protects vulnerable populations, and it shields Arizona taxpayers from massive penalties. Federal law mandates reform. The legislature has acted. If Governor Hobbs vetoes this package, Medicaid's costs will continue to grow unsubstantially. SNAP penalties could rise up to $300 million annually. Rural healthcare systems will suffer, and Arizona taxpayers will pay the price. The governor would deepen the conformity confusion and budget instability that have become hallmarks of her administration. It will create more chaos, more fiscal mismanagement, and more exposure for Arizona taxpayers. Republicans are offering stability and accountability to protect children and families who rely on these services. This is about fiscal responsibility. This is about preserving benefits for those who truly qualify. And this is about protecting Arizona's financial future. The governor needs to protect Arizona families. That's her job. We've done our part. She needs to sign these bills.
Good afternoon. State Senator John Kavanaugh. These bills are about SNAP, crackle, and popping fraud in government. We cannot be blind to the fact that these social programs have a tremendous potential for fraudulent abuse. Look at Minneapolis, massive abuse. And while I don't think Arizona has that level of fraud, I do believe that we have some. And these bills are designed to root out people who are not eligible because they have income that we don't know about, people who refuse to work, or people who are otherwise unqualified. We have to root these people out of our SNAP and Medicaid programs because, number one, they don't deserve to get taxpayers' dollars if they're not qualified. We need to respect the taxpayers. And number two, if we don't get our error rate down in SNAP, it will cost hundreds of millions of dollars in penalties that the federal government will place upon us, money that could otherwise go to other items like education, public safety, and the like. So we are making an effort to crack down. We hope that the governor agrees with this and goes along. One of my SNAP bills, which requires the agencies to directly or indirectly through contractors search people's incomes, residences, and eligibility, was vetoed last time. Now we know the cost of a high ever rate is hundreds of millions of dollars from our budget. So I'm hoping that we can get together with the governor, solve this problem, and spend the money the right way, not the wrong way.
Thank you. Representative Selena Bliss, the chairwoman of Health and Human Services, couldn't be here today, so she's asked that I read this statement on her behalf. Legislative Republicans answered the Trump administration call to reform our Medicaid and SNAP systems. Under the leadership of Speaker Montenegro, President Peterson, Majority Leader Carbone, Majority Leader Kavanaugh, the House and Senate Republicans came together to pass a comprehensive reform package that strengthens Medicaid eligibility verification, reduces improper payments, expands SNAP work requirements, prevents abuse of waivers, and protects Arizona's competitiveness for rural healthcare funding. One of the most important components of this package supports the Rural Health Transformation Program. The federal government appropriated $50 billion over 5 years to stabilize rural healthcare. For the first year of funding, Arizona received just $167 million out of a possible $200 million, ranking near the bottom nationally. Additional funding is available each year based on policy initiatives scored by CMS. If we want Arizona to compete, we must align our policies with federal standards. That is exactly what Republicans have done with this package. We passed measures to increase Arizona's Rural Health Transformation Program, score through workforce compacts like the Physician's Assistant Compact, the EMS Compact. We required the Department of Economic Security to reduce SNAP improper payments to 3% by 2030. We strengthened work requirements requiring data sharing between agencies, limited SNAP purchases to healthier food options, increased transparency over rural health dollars, and enforced stronger eligibility checks across Medicaid and public assistance programs. This is comprehensive reform. Our Medicaid and SNAP systems have become unsustainable after years of expansion beyond their original purpose. Medicaid is now a $23 billion program. If we fail to act, we risk losing federal financial participation, paying for ineligible enrollees with the state dollars, and allowing costs to continue to grow beyond intent. If we fail to reform SNAP, Arizona could face penalties that exceed $200 million annually. House and Senate Republicans have done our job. We passed Medicaid reform, we passed SNAP reform, we passed rural health measures. Now it's the governor's turn. Failure to sign the packages allows Medicaid spending to continue ballooning, triggering SNAP penalties that could exceed $200 million a year, jeopardizing rural health care funding, and ignores clear federal mandates under H.R. 1. Reform is not optional, it is required, and signing this legislation is the responsible choice for Arizonans. Thank you.
Good afternoon. State Senator Mark Fincham, Legislative District 1, serving Yavapai County. Also the chairman of the Joint Legislative Audit Committee. Over the last year, we have identified through our Auditor General the fact that the administration has failed to produce the audits that they are required to under federal law. That is an unacceptable performance. And the fact that we now have evidence of improper payments, we have to take actions to correct that. And this isn't, quite frankly, I don't think this is a Republican or Democrat thing. This is a people thing. When improper payments are made to people who don't qualify for them, that is literally stealing money away from those who might qualify. But as we run out of money, benefits go down. That is a reality. We're not like the federal government. We don't get to print money willy-nilly. We have to live within a budget, which doesn't seem to be something that the federal government knows how to do. But when it comes time for us to cover the cost, the human cost of individuals that need enough help to get by until they can find employment, we've got a responsibility to manage our resources aggressively to make sure that if somebody doesn't qualify, or if they cook in their own books, as it were, and they're not reporting income, they're not reporting some of the things that would disqualify them from the program, we've got to be able to identify those individuals, take them out of the program so that somebody who may be waiting for benefits can enter the program. With that, I think we're ready to take a couple of questions. Great.
Hi. So eligibility, as I understand it, is for both people that are maybe doing something fraudulent or not, really allowing them to be in the program, and then there's the other people that could be in the program but haven't been found, or are not in the program for some reason. Do you know what the percentage difference is in that? Are there is eligibility is the problem that we can't get the right people to sign up, or is it mainly a fraud problem?
I don't know the number. If you'd like to contact my office, we'll get it researched for you. But there's different buckets, and unfortunately, the governor vetoed the bill that would have allowed us to do performance audits. That seems kind of peculiar. If you don't know how a system is performing, how do you fix it? I've explained this before. Audits are not to vilify anybody. Audits are there so that you know whether a program is operating optimally or it's not. It's one way or the other. If it's not, then we have the opportunity to take corrective action and go after those things that will help reinforce the program itself.
Let me clarify one point. I just want to clarify, don't confuse the error rate with eligibility. The error rate is when the people administrating the program get something wrong. And that might be they gave somebody too much money, they gave somebody too little money, or they put somebody on who shouldn't be on. In terms of eligible people that don't sign up, there's no way to know how many there are. That's an impossible statistic. The error rate simply means that we overpaid somebody, or we underpaid somebody, or we found somebody on who shouldn't be on. That's the error rate. And those are things that we can monitor and control.
My question concerns that error rate, if you'd asked me about it.
We did not.
To answer your question, though, one of the bills, the Medicaid bills, does three things. It takes DES, Access, and DOR, Department of Revenue, and allows them to talk to one another to cross-reference all this, and it would fix everything. The problem is we dealt with the last 5 years self-attestation, and we've been still doing that, and so there has been a verification process to verify in a timely manner. If you look at what they've done with SNAP, in 45 days, over 300,000 people have been taken off of SNAP. No one is talking about that. Media has not shared that, whether you know that or not. But how did she do that, her agency do that in 45 days? You got to ask that question. So to answer that question, yeah, if we can cross-reference these bills do that, and it's a very simple process to bring together.
So just a real quick continue on that. Do you have numbers that show that if these bills are passed, and we get down to, we could get down to that error rate that we need to by doing the things that the bill says? Do we know that for sure?
Well, we just saw it in SNAP. SNAP is going to go down almost up to 300 million when we get to under 6%, and we would assume if you cross-reference through JLBC, they're saying about 200 million combined SNAP and Medicaid. Those are extremely conservative numbers. We think they're much, much higher. But if we do what SNAP has done, we can assume the same thing would happen to Medicaid to some degree. There's some truth in that. Those numbers would come down as well.
So if the error rate is 8.8% for SNAP, and you need to get it down to 6, and audits that came out of the Department of Education show the error rate for ESA is at 20%, what you're doing for SNAP is a good thing, but why not any kind of movement to rein in or work on ESA to get the fraud down on that?
Yeah, and we will address off topics at the end of the press conference, not right now. But with respect to the error rate, the intermediate goal is 6% to avoid hundreds of millions of dollars in federal dings. Then we want to get it to 3%, and one of our bills incentivizes the bureaucracy to do that. But ultimately, the goal should be 0%.
But please know there is no state currently doing 3%. None. So it seems like an unrealistic goal,
Are you
doesn't
going
it?
to send it to the ballot?
I'm sorry, I couldn't hear you over the
If this
noise.
package gets vetoed, do you want to send it to the ballot?
That's a possibility. It's very necessary legislation, and I'm not going to presume that the governor is going to cast away the necessary reforms to save us hundreds of millions of dollars that could be better spent on education and public safety. But if that were to happen, we can take this to the ballot.
On that 3% error rate, with the speed of implementation this might likely need to happen, what kind of accountability might be working to make sure that, with that speed that you can get to that 3% with, possible administrative issues that might happen when you're going to have to really have fast implemented?
as I said, we were at over 10%. We're down to around 8%, and the agency is removed 308,000 people who are not qualified for SNAP. I don't see any administrative issues right now. I don't see any in the future.
So we've done a lot of reporting at ABC 15 about the problems at DES in getting service. There's just not enough staffing to answer people's queries, to answer their appeals, to even answer their applications in a timely fashion. These reforms are essentially asking the department to do a lot more checking and a lot more work. So do you have a plan to get that implemented, given that the department is already not meeting the standards that it should meet with the work they have right now?
Well, they're meeting the standards again on SNAP. They could meet the same standards under Medicaid. We
Have a backlog on SNAP applications at DES of more
Again, one of the solutions here is to get all three agencies to speak with one another, Department of Revenue, Access, and DES. If they can do that, you'll do it immediately. You'll know that the answers pretty quickly. And I mean, there's also technology by AI. DES testified in committee. They needed between 50 to 80,000 to get some software that deals with this to answer your question. So we have no issues, and all the money that would be saved, that's a very affordable expense.
Okay, great.
Thank you.